Research indicates that the drug Wegovy may reduce the risk of heart attack, stroke, or heart disease-related death by 20%. That's the results of a major clinical trial in people with cardiovascular disease. It's the first to show a weight loss drug alone can have such protective effects. A similar trial of Ozempic also showed a dramatic result in cardiovascular risk, but it was only tested in patients with type 2 diabetes. So many questions about these drugs and their proper use. Our Sewell turned to an expert for some answers.
Ozempic and Wegovy are widely used as treatments for diabetics, but lately the class of meds has exploded in popularity as a weight loss option. And with that comes a lot of questions. Dr. Holly Lofton is a leading expert in the field of obesity medicine and director of the NYU Langone Medical Weight Management Program. She's joining us from New York. Good morning, Dr. Lofton.
Good morning, Kara. Thanks for having me.
Absolutely. So many people want to know, would this treatment be right for me? I'm sure you're getting that question a lot. So let's talk about who are the best candidates.
Yes, we have people walking in a lot of the time asking for these medications by name, and they really are approved for patients with overweight or obesity. So that's really defined by one's body mass index or BMI, which can be easily calculated if you have your height and weight. It's actually approved for ages 12 and up now. So a lot of people are candidates in America.
Who should not take the medication, though? I know there's a wide view, but are there specific people who you tell this is not for you?
Great question. It's important that the prescriber is familiar with the contraindications because there's a small degree of the population that are not candidates, even if they meet the weight criteria. And those would be patients with a history of themselves or a family member having medullary thyroid cancer, or a rare endocrine syndrome called multiple endocrine neoplasia. And also those with a history of pancreatitis should give this a second consideration because they may have worsening of pancreatitis if they've had it in the past.
Now, you mentioned that this is now available to kids from 12 and up. Let's talk about teens and what your thoughts are when it comes to prescribing it to those younger patients.
Recently, the trial, which was called STEP Teens, was published, and they looked at the effects of the Wegovy doses in teens 12 to 17, so adolescents. And they looked at 200 participants and either gave them placebo with lifestyle recommendations or gave them the semaglutide 2.4 Wegovy dose. And they found that it was safe and effective for weight management in this population. So again, it's important that the prescriber is familiar with it, that the patient and, of course, the patient's parents are able to comply with the follow-up and all the lifestyle recommendations.
So in addition to the teen potential side effects, what about adults and any side effects that folks should be potentially aware of?
The side effects tend to be gastrointestinally related because this medication looks just like a hormone that we make in our intestines called GLP-1. So those more common side effects are nausea. There's a 30 to 40% chance of nausea, and stool changes, loose stools, constipation are the more common side effects.
Now, if you're prescribed this medication, we know that people go, oh, this is great. But there are some follow-up tips and lifestyle recommendations that you sure give out. So let's talk about some of those that you tell your patients.
Yes, being on these medications is not a one and done. You should have regular follow-up with your prescriber or a dietitian, someone who's giving that lifestyle recommendation, because those are really where we get the effects when you combine the therapies. When you have lifestyle mixed with medication, and then also for the weight maintenance, you want to continue to see your prescriber or professional to evaluate how you're going to help keep the weight off. So this is not something that you take once or even continue taking on your own. It really needs close follow-up.
Is the drug actually intended for short-term use?
The drug is actually indicated for chronic weight management, and that means it's treating the disease that is your weight. Whether your weight is 200 pounds or 300 pounds, or if it's normal weight, you're still treating that weight condition that you had in some way, whether it's with medication or lifestyle. So the medications are intended to be used chronically, and that means essentially they can be used safely for life.
All right. Well, thank you so much. Great information, Dr. Lofton. We appreciate it so very much. For more information, you can go to nyulangone.org, or on social media, you can find her on Twitter at Dr. H. Lofton, that's Lofton, or on Instagram at skinnydoc_MD.